have conversations, you have to be a good listener. And active listening involves techniques like telling the person you're listening to, I get it, I feel what you're saying, and asking questions like, what do you think about this? How do you feel about this? The simple method we said to solve some of these frustrations is through conversations. The Conversation Project is a particular campaign that was put together starting about 2012 by a columnist, former columnist from the Boston Herald, whose name is Ellen Goodman. And in her situation, she had interviewed lots of people. She spent a lot of time with her mother, but in her mother's demise, she realized that she had never had any discussions with her about what her wishes were towards the end of her life. And when she passed away, she felt she needed to do something for humanity. So she started this project in cooperation with, she brought in a lot of journalists and physicians and lawyers and clergy, people from all walks of life, and in cooperation with a group called the Institute for Healthcare Improvement, they launched the Conversation Project, which is now something that goes on across the United States and internationally. And basically it's a campaign designed to encourage people to explore their wishes for how they'd like to be cared for at the end of their life, and to ensure that the healthcare system in our country respects those wishes. And she coined the phrase that one conversation can make all the difference. Now we brought some pamphlets here tonight, which you're free to take as many as you want. It's called the Conversation Starter Kit, and it's a device. Doesn't require a high-tech doctorate to understand it, and it really is something that helps you get into having this conversation. It's about what matters to you, not what's the matter with you. The question always comes up, just how soon should you have this conversation? And the real point to take home here is it's always too soon until it's too late. We spearheaded this project at the Medical Society. We've done it on a few levels, talking to caregivers, talking to physicians, talking to the public. And one of the things we talk about is something called death over dinner. Dinner time is a good time to begin the conversation. So pass the meatloaf, hey, how do you want to die? It doesn't have to be such a serious, morbid thing. Okay. Again, always too soon until it's too late. There's a number of examples we can talk about. There's the daughter who watches her mother in the last 2 weeks of life in the hospital on heavy-duty chemotherapy. She goes, I wonder if this is what Mom wanted. We have the son who shut down his dad every time his older father said, I want to talk about what I think I want as I approach the end of my life. And he goes, Dad, you're not dying, let's not talk about it. A few months later, he was dying, and he goes, gee, I should have had the conversation. We have the young couple where the wife was in a tragic automobile accident, and the husband had to make some very serious decisions for her, and he goes, I should have had some conversations. We have the older lady whose husband, she called 911, the EMTs came over, they were pounding on his chest for 15 minutes, even though he was dead already. She couldn't find the advance directive, which is interesting. There was a story that came out just yesterday in Reuters magazine. You may have seen this. It has to do with some guy at Jackson Memorial Hospital. And I think it was a 70-year-old guy that wheeled him in drunk, and he was out of it. And he had tattooed on his chest, DNR, do not resuscitate. He even had a signature on it. Okay, but a tattoo is not considered a legal document. So there was a complication until the family showed up. And, so I just throw that out there. It's complicated. It's not simple. Okay. Enough with that. Now, let me give you some statistics. Doctors got a few statistics. All right, 70%. That's the number of people who say they would like to be at home when they die. 70%, that's the number of people who in our country now actually die in hospitals or institutions. So clearly those wishes are not being honored. 90% of people, they say that talking with their loved ones and family is an important thing, talking about end-of-life care. Only 27%, less than a third, have actually had that conversation. 60% of individuals say they don't want their family to be burdened by making tough decisions, but 65% have never had the communication to communicate their end-of-life wishes. 80% in this study, this is a study done in the progressive state of California a few years back, 80% of people say they'd like to have that conversation, or the opportunity to have that conversation with their doctor about how they'd like to be treated at the end of their life. In California, only 7%. This was a few years back, but I don't know if it changed that much. Only 7% have actually had that conversation, even with the doctors. Why don't they have the conversation with the doctors? I don't know. We have so many subspecialists these days. Maybe they just need to be referred out to someone who can have the conversation. But physicians are just like everybody else. We find it really uncomfortable, oftentimes, to have that conversation. I remember I'm a dermatologist, and luckily I don't have too many people acutely dying on me. But when I was an intern doing general medicine a few years back, the attendings, who are professors, I know they were uncomfortable with talking about this. So when a patient died at 3 o'clock in the morning, they would ask you as the intern to get on the phone and call the family. And there was just one line which I remember. You'd call them, your husband has taken a turn for the worse. I think you should come down to the hospital. That was the standard line. Nobody really wanted to talk about it. So even physicians have a challenge talking about this. The federal government realized or agrees that this is an important conversation about end-of-life choices that doctors should be having with their patients. Starting last year in 2016, Medicare actually reimburses $89 per half hour of conversation doctors have with their patients. So it's a billable code. And statistically, the AMA predicted there would be about 350,000 of these conversations in the first year, almost 600,000. At least they bill for 600,000 times. But what's interesting, that's only about 1% of the Medicare population. So there's still a lot of people that haven't had that conversation. Why not? Perhaps, again, the doctors have a little bit of fear in initiating that. There's also this concept of that, is this the death panels? Something that was out a few years ago, as I recall, during one of the presidential campaigns. And they're not death panels. These are opportunities to talk about your core values and your wishes. But even as recently as last year, a congressman from Iowa, whose name is Stephen King, he proposed a bill called the Protecting Life Until Natural Death Act. And basically it was to cut the Medicare reimbursement. And he said, I quote, this is, the reimbursement is financially motivated. It's not in the interest of Americans who were promised life-sustaining care in their older years. And it's interesting because, just to make a little commentary, with some of the things going on now and the cuts that are imminent, I'm not so sure that these same guys in the government really care about funding these life-sustaining care at the end of life. But I can assure you from my perspective, and I've been part of this for a while, I would totally disagree with this being a death panel thing. It's about allowing people like you and I to make informed decisions. It's not about cost savings. It's about person-centered care. It's about taking the time when people are ill, or particularly long before you're ill. Like I said, better to have these conversations at the dinner table than in the ICU.